Doctors, nurses of Reddit. What's the craziest injury a patient of yours has survived? In our end school in the had these landscapers that had to trim some hedges. They didn't have a trimmer, and one of them had the brilliant idea to use a push mower with their hands. That went as well as you'd think. Had another middle-aged man walk in with his wife and teenage daughter that wouldn't sit down. Turns out he shoved a mag light up there and perforated his colon. Dumbass had to have surgery. And lastly, during my psych rotation, had a guy that was basically a shell of a person as he tried committing suicide via gun to his head twice and survived both tries. Rupture, thoracic aortic aneurysm. It has a crazy high mortality rate. Happened outside the hospital in an 80-year-old male. After a 10-hour surgery to repair it, they got to me in the ICU. The chest tube, placed to prevent a build-up of blood around the heart post-up, dumped 2 liters of blood over an hour, and they ended up going back for a revision of the operative area. I self-extubated a couple days later and left the ICU after a week. He was motoring around the unit like he didn't just have a bomb explode in his chest. Legs in a wood chipper. Not that surprising that he survived, but my god, the damage. And then, everything got infected. Not sure if he survived that part. Attempted suicide off a bridge onto concrete. He'll never walk again but survived. Or sure, he'll survive his mental health issues. Acid attack to the face. I suppose that's also not a crazy survival story. At the surgeries after surgeries the poor girl had to go through to even look somewhat human. 2 gunshot wound to the head. Witnessed by police. Guy was having some kind of psych incident, and when PD showed up, he lost it and put his 9mm his head and pulled the trigger. He was sedated and intubated on scene. Brought to a visible entry wound on his head. Cut ACT when he got to us and, wait, where is the bullet? Between his scalp and skull. I still don't understand. That was a wild case. Not a medical clinician, but a friend of mine was shot while pulling out of a gas station by an unknown assailant, never caught, but the theory said it was a gang initiation. Bullet went into his left temple and came out his right temple. He just had butterfly bandages on his head. Severed one optic nerve and damaged the other. It didn't touch his brain. He made his own 911 call. My wife is an ed consultant. Back in Australia, she dealt with the final attempt of a guy who kept trying to kill himself. Eventually, he threw himself in front of a Perth train and both legs and one arm came off. He then decided he wanted to live, apparently. From my understanding, he arrived with bits attached via skin. Maybe not the craziest injury, but I once had a 101-year-old patient who fell down the stairs and broke her neck. No prior medical history and no other injuries. She was just very annoyed with the neck brace she had to wear and wanted to go home. She was discharged a week later. Not mine, a former boss of mine. When he was an intern in the Johns Hopkins, had a patient come in with a W-beam guardrail through the center of his abdomen. Not only was said patient alive, he was stable, conscious, and talking. Nothing important had been hit. Suicide attempt. Crossbow to the head. Entry was from the mouth and exiting out the top of the head. The arrow was sticking straight through his head like a cartoon. He was alert, oriented, and much calmer than you would think. He was fine. Had a lady in her early 20s who was pregnant with her 5th child. She tried to end her pregnancy with a handgun to her belly. The fetus survived. Tried to get her admitted to psych, but she refused and she was discharged to finish the pregnancy. Oh wow, I have so many. One guy was thrown from his car and impaled on a tree. Another guy choked on a sandwich and his wife gave him the Heimlich and perforated his esophagus. Another guy attempted suicide by swallowing a hanger. Young guy stabbed in the heart brought in by POV. He arrested shortly after arrival. Dear Doc cracked his chest, sutured the hole, and did internal cardiac massage. We got him back. 2 days in the ICU and he went home. I had a dude come in because his scaffolding gave out and he fell approximately 15 feet and saddled a bar right on his testicles. Lucky for him, no fracture or scrambled eggs in his scrotum. Lots of abrasions and bruising. Had a gentleman fall in the construction site and land on rebar, pierced through the stomach. Luckily, ants were able to bring him in with the rebar still in. He survived the next day. Was a nurse in my former life. Aortic dissection from the neck to the groin. She was grey and somehow survived. Literally just a complete fluke that she survived. Entire pole through the head after a traffic accident when I was a resident. They had to cut off the ends of the pole to get him through the CT scanner. I'm a paramedic and someone survived a stab wound that would have been fatal if the blade wasn't an inch closer to his heart. It was wild. Girlfriend works at a hospital and she saw a patient father said degloving of the scrotum.